this is Hillary with the Nurse Preceptor channel. Welcome back. This is my 11th video for the month of September, and I'm celebrating the month of September because we have 30 preps in 30 days. It's National Preparedness Month. Today we're going to talk about essential purchases for respiratory emergencies. You see right here I have a whole cart full of respiratory purchases that I find to be more or less essential, and I consider them at least all very good things to have in your arsenal if you should need them. If you like this video and find any of it helpful at all, please give me a thumbs up and consider subscribing to my channel. Hit the bell for notifications of new videos that are coming out. And I'm going to be covering a lot of emergency preparedness topics this month especially. My first job out of nursing school was as a respiratory nurse, and I found out very, very quickly, if there was any doubt in my mind at all, about how important it is to be able to breathe and how scary it is when you can't. Working on that floor with people who had a lot of lung disease certainly showed me that. We've worked with people who had COPD, emphysema, bronchitis, occasionally people who had a pneumothorax where they had a chest tube in place, and a lot of people who had issues with pneumonia. And this was all way pre-COVID, so it was not really an issue back then, but people did have all kinds of really wild pneumonias and other infections. And not being able to breathe, not being able to clear your airway of all the phlegm and secretions can be a terrifying thing. And right at this point in time, probably the last place that you want to end up is in the emergency room or a really crowded urgent care office waiting to be seen. At least in my neck of the woods right now, I'm hearing from doctors that sometimes the wait for a bed in the hospital, if you come in through the ED, can be upward of 24 hours, and it can be 6 to 8 hours before anyone even sees you. So being able to identify early problems at home and self-manage to the best of your ability is really your best opportunity to stay out of the hospital and to be able to manage your own health care. In another video earlier this month, I covered the rule of threes, and of course the first thing is 3 minutes without air, 3 minutes without oxygen, and you're in a lot of trouble if you can't resolve that within 3 minutes time. It means death. While I haven't done any medical preps quite to the extent of having oxygen canisters or a ventilator in my own house, I've got a lot of other supplies that are very helpful in the event of emergencies. I want to emphasize, as with everything, being able to prevent is better than being able to treat. So if you know that you're prone to things that tend to set you up for things like upper respiratory infections, and this would include like problems with asthma, problems with allergies, make sure that you're managing these problems ongoing. Make sure you're keeping your health optimal by having enough vitamins, by hydrating well, and getting outside in the fresh air plenty, and getting your exercise and keeping your stress down. So those are the basics. Now let's talk about a few things that I think you should consider purchasing now rather than later, and they might help you to be able to self-manage a little bit more effectively. So I've mentioned allergy control already. If you're someone like me who has basically 4-season allergies, it's a really good idea to either manage your allergies by staying away from them, or if you're like me and your allergies are outside and inside, consider something like a Claritin or a Zyrtec or an Allegra or a Zysol over-the-counter treatment on a daily basis to keep your allergy symptoms minimal. With me, I tend to develop a lot of phlegm and a lot of drainage in my upper airway, and sometimes that does kind of leak down, and I end up developing a bronchitis or a deep chest cold because I've had so much drainage end up in my upper airway leaking down into my lower airway. I try to keep myself really well medicated with my allergy medicine. But I want to say this also. If you're someone who is prone to say allergic reactions that are going to compromise your airway, allergies tend to bronchoconstrict, which means your airway, actually the width of your airway will narrow because those cells become very inflamed. It's kind of like having the inside of your windpipe just become extremely inflamed, so it makes the airflow a little bit more difficult. It's a very good idea to keep something like liquid Benadryl, or this is generic Walgreens Waldrill. Liquid diphenhydramine is the best option if you're someone who's prone to having very severe or sudden allergic reactions, because the sooner you can take something like that, the less histamine you're going to have circulating in your body, and your body will then be able to resolve the inflammation in your airway. While diphenhydramine or Benadryl or the off-brands of that are first-generation antihistamines, Claritin, Zyrtec, Xyzal, Allegra are all second-generation antihistamines, and the major difference between the two is that the first-generation ones will tend to make you very drowsy, the second generations not so much. In the setting where you're having an allergic reaction that irritates your airway, you want to have one or the other available, preferably the first generation because they're very potent. But if the second generation is all that you have, take it. Take it and don't waste any time. And if you have an EpiPen, especially if you're someone who gets very severe allergic reactions, go ahead and take it if you're exposed to something that starts giving you that allergic reaction. And EpiPens are one of those things that you get by prescription only. Make sure you always know where it is and realize that it's really intended as bridge therapy to get you safely to the hospital for further evaluation. So don't think that you're cured because you took the EpiPen and you feel better. It has calmed it down for the time being, but it will rebound at some point. The second group of drugs I want to talk about is bronchodilators. If you're somebody who takes an inhaler or somebody who uses a nebulizer with nebulized bronchodilators, you know what I'm talking about. Albuterol, Atrovent. If you are someone who requires prescriptions on a regular basis, make sure you have an extra supply of those available. It's a very good idea at all times, but especially now with so many things being in short supply, make sure you have a little bit extra just in case. If you're somebody who doesn't require a prescription bronchodilator, there is the option for over-the-counter bronchodilators. Primatene Mist is one of the old ones that's available still. It is an inhaler. You can carry it with you. From time to time, especially in the spring when my allergies get really, really bad, I will sometimes carry this with me because if I'm out exercising in the pollen, I start wheezing like where I can hear it and I can feel it. And it usually gets me, really quickly, it gives me some relief. Now, the active ingredient in this is epinephrine. So it's basically the same stuff that is in an EpiPen. It's just inhaled. And you can also take ephedrine over the counter in tablet form. It does pretty much the same thing. It's going to make you feel very jittery and really maybe even kind of queasy for a little bit, but it will dilate your bronchi and you'll be able to breathe much easier, and it should really help out with the wheezing if you're having that. In any case, even if you're someone who requires a prescription, if you run out, something like a Primatene Mist inhaler is better than not having anything at all. Now, the next thing I wanted to mention is that I actually went ahead and bought a home nebulizer. Now, in order to buy the nebulizers at the drugstore, you do have to have a prescription, but you can go online and find places that will sell them to you. You pay out of pocket, but you can get it without a prescription. And there's no reason you should need a prescription for it. Because one thing that you can use that will help sometimes calm down an airway that's very irritated, for example, if you have a kid that has the croup or some kind of a bronchitis, or you're just having a lot of dry hacking that won't go away. I know some people who have COVID where it's kind of a bronchitis, it gives them like this really dry barking cough. What you can do is take some saline, put it on ice, and once it's nice and cool, or I guess you could put the saline in the fridge, pour it into your nebulizer and just breathe in this really cool saline. And what it will do is it's almost like putting an ice pack on your smooth muscle. It's going to help your bronchi to relax and you'll be able to breathe a little bit better. And it also might help to moisturize those airways so that you don't have that dry, barking, harsh cough. One other thing that I've made note of that I've actually read some research on is the use of a really dilute peroxide solution. This is something that's been studied. It's been in some peer-reviewed literature, and they use this in other countries sometimes when they don't have access to a lot of the same medical treatments that we have here. The study that I found that was well referenced recommended the use of a kind of a home mixed saline and peroxide solution, where they used 3% hydrogen peroxide, which is the same peroxide you get at the drugstore. They used 5 mLs of that mixed with 70 mLs of normal saline or distilled water, and mixed that all together, and then put the amount in that the nebulizer would take, and then nebulized it. and people ended up with a resolution of symptoms in the study that I read. So it's a very interesting use of peroxide, and it's something that we don't do widely, but it does seem to have some clinical basis and seems to be backed up by the research that I read. Now, if you're going to have some kind of a nebulizer, you'll want to have these. And we called them saline bullets at the hospital, but it's just individual packets of saline. You pull it off of the others, open it, and it's sterile saline inside here, single use, and then you throw it away. Even if you have prescription medication that you use in your nebulizer, you'll want to dilute it with that sterile saline. I have a couple more devices here I'm going to show you. I've already addressed the sinus steamer when I talked about sinus control in one of my prior videos. So check that out. It's really easy to use. It does really help if you get congested up through your sinuses, and it can help you to be able to drain some of that out and cough some of the phlegm out before it gets down into your lower airway and becomes a big petri dish for growing bacteria. Something else we used a lot, and this is something we recommended frequently during the winter months, especially in pediatrics. This is a home room humidifier. You fill this up with water and let it run, and it provides a cool mist in the room overnight, and it basically helps to moisturize the air, especially during times like during the winter when the heat's on and the air gets really dried out. It causes all of your mucous membranes to get dry, and it causes your secretions to become very dry as well. And the unfortunate thing is when that happens, then it becomes harder to cough stuff up. And again, like that mucus that's so thick becomes a very good breeding ground for all kinds of bacteria. The one final thing I wanted to mention is old-fashioned Vaporub. It's menthol and camphor. You probably know it most likely as Vicks. It smells nice and fresh and minty. You can use this just topically on the chest. Some people put it on the feet and they say that it seems to help. It does give you a nice tingly feeling and makes your airway feel a little bit more open. One more thing. So these little cans of oxygen that you can buy online, there was a company charging like $50 for 3 cans. And I can tell you, even though it's supposed to be pure oxygen, I got this when I was skiing out west where we're at a really high elevation. I couldn't imagine that this has more than just a few puffs of oxygen in it, so I probably would be inclined to save my money and maybe spend my energy on things like just really drinking a lot of fluid, getting up, getting some exercise, and making sure that I'm doing very purposeful coughing. Now, I don't have any kind of a spirometer device or anything in here to show you, but you don't need one. You can take a kid's balloon, like a latex balloon from a party, and practice just blowing it up, and that's going to do the same thing that an incentive spirometer would do, and that's just something to encourage you to take deep breaths and to blow out with resistance. It keeps your airways open, and it helps you to cough a little bit more effectively. So I hope all this helps. Again, prevention, prevention, prevention. Don't forget your hand washing. Try to stay away from crowds, especially if there are outbreaks in your area, and identify the early signs of respiratory trouble. And that would be things like fever, cough, especially runny nose, feeling kind of achy, kind of viral. And if you start getting that nice, heavy kind of burning sensation in your lungs, maybe start some of these interventions and try to figure out what works for you and keep yourself really well. All right? Stay safe, everybody. I will see you next time.